Hi, my name is Kari North and I'm a genetic epidemiologist. I work at UNC Chapel Hill and I am in the Department of Epidemiology in the Gilling School of Public Health.
February is American Heart Awareness Month. Why is this federal observance so important, especially as it pertains to obesity and heart disease?
Well, as you know, obesity has increased dramatically over the past 30 years, doubling in prevalence. Not only that, but overweight has dramatically increased in populations across the world and in the US, and it has its hardest hits individuals, minority populations, and women who are over the age of 60. This is so important because it parallels rises in the increase in cardiovascular disease in the population as well.
What are some misconceptions about obesity and heart disease?
Well, that's a really interesting question. Despite the widely accepted, well-documented relationship between obesity and cardiovascular events, there are studies that show that there's some heterogeneity in who gets sick when they're obese and who actually has cardiovascular events. And we think that this heterogeneity is largely related to the way that we've been studying obesity. For example, most of the time we study obesity and its relationship to heart disease and stroke, we look at one point in time. But what we realize is how long you're obese, not just at that one point in time, but the duration, how long you've been obese, is probably very important. Also, severity of obesity matters. So for example, people who have extreme obesity are at much higher risk of heart disease and stroke than individuals who are just overweight or just mildly obese. And lastly, where you distribute your body fat is extremely important. So we know everyone is familiar with this whole difference between individuals who are shaped like an apple versus shaped like a pear. And what we understand is that individuals who distribute their fat in the apple type shape are at much higher risk than individuals who have their fat distributed in a pear-like shape, largely related to how easy the fat can get to the organs and cause damage.
How do you prevent heart disease and obesity?
That's a really important question. And if we can prevent obesity or treat obesity effectively, we can affect so many of the risk factors for heart disease, for example, hypertension, high cholesterol, diabetes, or insulin resistance. So if we just think about using North Carolina, my home state, as an example, we rank 16th right now in the rates of obesity. And if we were just to change the average BMI by 5%, that would reduce the healthcare expenditures by $7 billion in just 10 years. So a little bit of change, just 5% change, can have a huge effect and an impact on the global burden of heart disease. I think it's also important to note that, so far we've been treating obesity one-size-fits-all treatments. And we know that it is not just a simple disease of energy balance and willpower. We understand now that it's a complex set of behavioral, social, economic, and molecular mechanisms that influence your predisposition to obesity, and we need to start treating obesity like the disease that it is. It's not just one disease, it's really a cascade of diseases with different causes and consequences, and we need to better understand that so that we can better, more effectively treat it.